My name is Wyly Gray. I am a Marine veteran and the founding director of Veterans of War. Veterans of War is a 501c3 nonprofit that connects teams of veterans to guided psychedelic group therapy fellowships designed to heal the scars of war. What we're going to do today is take a look at the journey of healing that I've undertaken to date, both on and off the grid, to try to find relief from post-traumatic stress disorder since 2009. For me, it manifested as insomnia, nightmares, severe anxiety, violent outbursts, rage, and even suicidal ideations. At the worst of it, I truly believed that I was poisoning my family. It would take me years of further study and continuing dark experiences to finally push me over the edge to seek out plant medicine deep in the jungles of Peru. But it's ridiculous that I even had to do that I had to go on such a dangerous trip by myself in a foreign country where I didn't speak the language to get access to a medicine that there wasn't a lot of information about. It took me more than a decade of suffering just to overcome my fear and take that leap. I'm forever grateful that I did, because I wouldn't be here today without it. But that it's 2020 and these safe and effective solutions for overcoming trauma have been on the planet, living with us for millennia, and we're talking about them now as though they're somehow novel approaches or new, only reflects our lack of study and not their efficacy or their continued persistence in our culture. So what did I end up finding? I found a path towards healing that's paved in hard work, that's highlighted by the intense connection I was reminded we all share in ayahuasca. Ayahuasca for me, which if you're unfamiliar, is simply a psychedelic tea. The medicine and access to it in whatever form it comes in, those are incredibly important parts of this. But equally important is the integration work that is expected for you to be successful afterwards. One of the first things that I realized was that so many of the manifestations of trauma that I was dealing with, whether it was the insomnia, the hypervigilance, hyperarousal, or the suicidal thoughts and ideations, they were all tied to my experiences. So once you see the paths and you identify the way to make it better, then comes the real work. Then comes the hard integrative work of using those paths constantly, forging them again and again in your mind, walking through them again and again so that they become your new neural normal. Welcome to changing the mental health paradigm regarding trauma, plant medicine, and veteran suicide. Before we can change the paradigm, we have to identify its tenets. How have we as modern society dealt with mental health care? And specifically for this specific question, how have we dealt with veteran mental health care? The VA response can be broadly labeled as trauma-focused psychotherapy coupled with lifelong medications such as SSRIs or sleep aids. Trauma-focused psychotherapy means therapy that involves multiple talk therapy sessions, typically between 8 and 16, where veterans are visualizing, talking, and thinking about traumatic memories in an effort to change unhelpful belief patterns. The typical therapies offered include prolonged exposure, which is when you face your negative feelings directly, cognitive processing therapy or CPT, which is when you reframe your negative thoughts actively, and then finally, eye movement desensitization and reprocessing, or EMDR, where the participant will replay trauma again and again while focusing on a repetitive sound or trigger, trying to lessen the severity of their expression with each iteration. So, in layman's terms, veterans are asked to relive their most painful traumatic memories again and again and again until, like rubbing a wound, until you can't feel the sting, we're supposed to have somehow dealt with it. While this does show promise for some veterans, as you can imagine, for other veterans, it's incredibly triggering and can exacerbate some of the functions. The only other option that's presented to us, and it's typically already in tandem with the other options that I presented, is medication. The VA actively touts the efficacy of Zoloft, Paxil, Prozac, and Effexor for the treatment of PTSD. These are the same medications that civilians would take for the very same indications. They're supposed to be taken daily until there is no need. They typically take about 2 months of daily intake before they reach full effect, and dosage changes depending on the individual. So finding the right chemistry and the right doctor is incredibly important. The problem with this method, at least topically, is because there's a chemical and a physical change in your brain, what you tend to do now, instead of actually changing the relationship to that trauma or healing the trauma itself, is put a Band-Aid on each of these different manifestations of trauma. What happens if the Band-Aid is dangerous too? The first real side effect for many of the SSRIs that I've named is, and I quote, SSRIs have been shown to increase the risk of suicidal thoughts and behavior in patients when used to treat major depressive disorders or other psychiatric disorders. So veterans who are potentially suicidal already are being given medicine that may in fact reinforce their negative predisposition. That seems incredible, but that's the truth of the paradigm for mental health care for veterans as it stands today. And I'll remind you that that clock is ticking in the United States to the tune of 120 people, Americans, lost to suicide every day. And of that 120, 20 of which are veterans. We're highly overrepresented. And all of which are being prescribed, for the most part, these antidepressants. So the current research seems to indicate that these changes in mood are a result of actual physical changes in the brain itself. Functioning MRI studies have shown that individuals with PTSD have an exaggerated amygdala response to emotional stimuli, especially when compared to controls. To put that in layman's terms, our fight or flight response seems to be always triggered. So what does that mean? That means that it may not be possible to talk your way out of your crazy. The model seems to be talk therapy coupled with a medication that is given whack-a-mole style in order to suppress the presentation of symptoms. And this is continued in perpetuity. As soon as you stop taking your medication, your symptoms will present again. So what we're really offering people is the cessation of symptomology, but literally nothing in terms of how do I reconnect and overcome this trauma. I'd also like to give a quick shout out to Jesse Gould of Heroic Hearts Project and Amber and Marcus Capone from VETS. These organizations have laid the groundwork for mental health care solutions in the veteran community. Their work has paved the way for the group psychedelic assisted psychotherapy model that we use at Veterans of War. And early on, when I was crafting what Veterans of War would look like, they were integral to my success. As a quick aside, if you haven't had a chance to see London Reel's recently released documentary called Reconnect on YouTube, I highly encourage it. It's the only documentary regarding ayahuasca that I've seen that accurately depicts the interactive, difficult nature of the work needed for proper long-term integration.